Hey, thank you so much for joining us again today. My name is Brittany Doyle. I'm the founder of Wise Health SF, which is a public health consulting company located here in San Francisco, California. We focus on increasing access to health equity strategies, programs, and services throughout the entire Bay Area. For this project, Free Your Mind San Francisco, I'm working in collaboration with the Department of Status of Women. Free Your Mind San Francisco is a mental health awareness campaign that is designed to increase access to education, resources, and treatment within marginalized San Francisco communities. We have a series of events that are taking place across the city. We're calling them mental health tune-ups. We're providing mental health first aid training to our youth. And then we're also sharing education through this podcast series. So I'll be sitting down with a few leaders that are working, developing, and innovating to address mental health, like who we have here today, Dr. Stephanie J. Wong. Dr. Wong is an experienced licensed clinical psychologist and healthcare program administrator who specializes in mental health and substance use disorder treatment for veterans, tech professionals, and individuals from diverse backgrounds. Her expertise includes guiding people through life transitions, vocational rehabilitation, and offering integrative therapy for individuals, couples, and groups. She is the founder and host of the award-winning Color of Success podcast, dedicated to destigmatizing mental health within the AAPI and ethnic minority communities. The podcast shares stories of individuals as they build careers, brands, and businesses while highlighting strategies to overcome self-doubt, anxiety, and barriers. She also explores the intersection of pop culture, such as K-pop, and mental health to engage and inspire listeners. Last November, she released Cancel the Filter, Realities of a Psychologist, Podcaster, and Working Mother of Color, which can be found on Amazon. With a deep understanding of the challenges professionals face, she blends her knowledge of mental health, culture, and business to provide insights and support for those navigating careers in entrepreneurship. I'm so glad that you are here joining us today. We definitely have a lot to talk about, Dr. Wong. So thank you so much for
Thank
being
you
here.
so much for that introduction, Brittany. That was very, very kind words. And I'm just so excited to do the interview. You and I hit it off when we had a brief call. And I just love what you're doing for the community. I'm a San Francisco native. And so when you told me all the things that you're doing for the community, I was just like, yeah, let's talk more about these things. It's so important.
Yes, thank you. So, what inspired you to create the Color of Success podcast? And how does your background as a clinical psychologist influence, a lot of the stories that you talk about?
Well, it all was a pandemic project, right? I think for most of us, we looked for ways to connect with others. And for me, I just took a free class because I love free um, with Dr. Melvin Varghese, who I used his podcast to help build my private practice when I started very early in 2016, and he was talking about what message do you want to send to the world. Now, I didn't imagine building a podcast. I literally was just taking it very curious. And then I sat down and I said, if I were, what would that be? And
Mhm.
I noticed that, especially in the pandemic, when there is a lot of, and continues to be, overt racism, and there was a lot of hate crimes in the ANHPI community, and I really couldn't see everyone one on one. It was great that people were seeking out my services, and I just could not keep up with the requests. So I said, okay, let me create a platform to have these conversations, to have these discussions, and hopefully that can be one of many resources that people can go to while they are maybe awaiting services or even considering services. So it started very small in my mind of like, let's just see who would be willing to share their stories. How could we talk a little bit more about how they've coped with their own mental health challenges while they are still seemingly perceived as successful, right? Like, I think sometimes people don't really acknowledge all the things behind the scenes or internally that's going on. And we see everything on social media and we're like, oh my gosh, like this person's doing so great. And there were so many things that they continue to work on to maintain their trajectory in the career that they want. So,
Yeah, and what were some of the common challenges that people talked about? I checked out a lot of the episodes and like the array of people that you interviewed. I mean, from all different backgrounds. And so, what did you see was like the commonality of a lot of the things that they were talking about?
well, and we'll dig into this. Self-doubt was huge and
Mm,
is huge.
yeah.
I think that when you're in an industry, in any industry where you feel isolated or one of the only or the first,
Mm,
it can be pretty lonely. Being an entrepreneur can be lonely many, many times if you are a solo entrepreneur as well. And so people have can get in their heads a lot and want to quit. And I think even with the recent interviews that I've been doing, rejection is a huge thing.
mm,
It is a reality, and also sometimes folks can catastrophize rejection as well. And
mhm.
so it really is building up those skills to know that it's not necessarily just about you if someone says no. And what do you do moving forward? The other part is we really address societal issues that are going on because we're not operating just by ourselves. There's cultural context, psychosocial issues that go on, and just being aware of those and how to manage some many things that are out of our control. How can we exert our self-control, our locus of control, when there are a lot of things that are uncontrollable?
Yeah. I think about I've been a entrepreneur going on almost 10 years. It'll be 10 years next year. And like you said, a lot of times I am the first, especially in a community where there's so many nonprofits, the competition is real for people to recognize, my skills and what I bring to the table. And having imposter syndrome is something that I've been dealing with for years, and I know I'm not the only one, but yet I still have to show up. Now,
Mhm.
how would you recommend people manage those type of feelings of imposter syndrome? Just the social anxiety is another one. How do you?
Definitely.
Mhm,
Well, this really helped. I'm part of the Ascend Women in Leadership cohort this year. And
mhm,
one thing that really struck me from one of the speakers yesterday was really keeping a visible list or a visible marker of some of the compliments that we've received.
mhm,
And I think it seems so simple, but it's such a novel idea because we tend to focus on all the things that we think we did wrong, or that, things that have gone wrong or not the way that we've wanted to. And so when you actually look at some of the things people in key leadership roles or support systems have said about you, that could really start to combat some of the negative thoughts that we may have. The other thing is really taking a strength based approach, being honest with yourself. What do I bring to the table? What have I excelled in? And also recognizing, okay, I'm not as strong in this area, but who can I reach out to strengthen these skills? Or what can I learn in order to strengthen that muscle? But I think another technique that I've used, I haven't done it in a while because I've been in positions for a couple of years, but really brushing up your resume or curriculum vitae
mhm,
to show all the things that you've done, not because you're submitting it for another job, but because you start to reflect like, wow, I actually have been an entrepreneur for 10 years, or,
mhm.
I've started a podcast and done X, Y, and Z in the community. Then you start to reflect like you have this actual tangible item that shows you like I'm not just sitting here and doing nothing. These are the things that I've accomplished. So I think sometimes really trying to figure out some tangible markers for yourself to address some of the self-doubt can be really helpful.
Yeah, that's really good. I'm also seeing a lot of like mid-career transitions. I don't even know if it's called mid-career transitions. Like
Yeah.
my mom and like our grandparents, they stayed in like the same career, maybe even the same job the entire time. And now there's people that are like mid 40s or early 40s, late 30s that have been doing excelling in their job, doing great. And maybe even hit that peak. And now they're like, I think I want something else, transitioning into something totally different. And even though that's a very bold and daring thing to do, it also causes a lot of anxiety
Mhm.
as well. And at times can be very debilitating. Have you been seeing a lot of that? And is there any, recommendations that you can give for people that are dealing with those types of anxieties, transitioning in their career?
Listen, I'll be super honest. I just turned 40 and I was like, my goal was like, oh my God, I want to be retired by 40. And clearly I didn't reach that goal. And so I'm just like putting it out there. Like it was my half joke. Obviously, like I wouldn't like do nothing. But I think that one thing is to really understand, what do you really want to get moving forward in your career?
Mhm.
It may not be jumping ship like right away or whatnot, but if you're looking for making an impact in the community, or, um, you know, maybe promotion opportunities. It really does inform kind of your next steps. Um, and also really connect with people that are really supportive, because many people, I see it with so many people, and social media has this like these clips of like millennials just saying like, oh, I'm so burnt out, like I want to, fire, I want to retire and stuff like that, right? And it's a half joke, but there's so many people in the millennial generation that I've encountered that feel that exact same way. So I think when you don't feel alone, that's when you can start to have these conversations and brainstorm and connect with people that may have other opportunities, or um, really identifying what's really contributing to the anxiety that you're feeling. Is it because you're worried about the finances of like meeting new people? And when you drill down on what that is, then you can kind of make a plan. But sometimes it just becomes a ball of anxiety, and you just, you need to unravel it a little bit.
Yeah, I know for me, it's the thought of sitting in an office again. Or like, because I've been, I've worked alone and I've been an entrepreneur for so long
Yeah.
that I've had my own schedule, I do what I want, but I kind of miss that structure. At least I think I do. Or like at least the coworkers. But I know that I would love to do something different, but it's just like the thought of like learning something new, or the systems, or whatever, are just like things that I know give me a lot of pause. And then there's like I run into a lot of people that just love what they do. They're nose deep in their career, and they lose their sense of self, like their identity. Um, and oftentimes like their purpose. Do you see that a lot?
I think, like you mentioned, our parents, grandparents, I think they were forced in a way to stay in these jobs for decades.
Mhm.
And there wasn't really thought on like, am I losing myself? I think it's in a way it's a luxury for us now to really think about that as a generation, and our kids and so forth, newer generations. But I see even those in the tech field, let's just say, they start out really young, they come right out of college, and they may be thrown into management positions that, you know, you and I have been in the business for a little bit, but can I just reflect on if I were like 21 and having to like manage, various people that are like, who is this person, and not having the same skill set as I do now. I mean, it's a huge learning curve, not saying that people can't do that, but there is a lot of different ways that people can lose themselves without the proper like mentorship, training,
Mhm.
self-reflection. And I see it a lot, and people burn out very quickly. I know that's become like a buzzword nowadays, but there's a lot of truth in it, because back in the day there was also some sense of security, I think, in some companies, because you expected to be there. Not saying people didn't get laid off, but you expected to like have this mutual respect of, I'm going to be here for 20 or 30 years. I'm going to, you kind of live there with a work family. Nowadays, there's so much transition, worry about layoffs, and all those things. So I think part of it is really understanding and drilling down to your values. Like, if this organization or the situation's not serving me, what am I going to do moving forward? And sometimes that is taking a break. A lot of folks are taking like a gap year, like folks used to do, before they went to college or whatnot. And that's another thing. College may not be a thing when my kids are ready to do that, right? So I think, the values piece is what is constant, for us when we're identifying how to make decisions.
Yeah. Yeah, that gap year is important. I actually have a really close friend that was a news anchor out here, and she just one day woke up and was like, "Oh, I need a break." She wasn't feeling good, the
Mhm.
stressors of her career, and she decided to take a gap year. And I know that, you know, it's a blessing to be able to do that because, not everybody can afford to take off time, especially a year,
Mhm.
but that is definitely to me like taking control, of your life and what you want to see for yourself. And that's, slowing down and caring for yourself at the same time. And then you brought up something else that I think is so important, mentorship. Um, you know, that is in my sector, working in public health, it's not a lot of mentors out there, and I could really, really use one. How would you recommend people go about getting a mentor?
I think networking events are really helpful, as well as now we have social media, LinkedIn, etc. And not everyone's going to say yes, like let's have an informational interview or a coffee chat. I think a lot of people get kind of inundated in their mailboxes or whatnot, or inboxes. However, like even for you, like you just reached out to me and we're having this amazing conversation, right? And so I think these beautiful things can happen if you reach out to people that you feel like you could make a connection with. And it's not always like, hey, can you be my mentor? Because sometimes you just don't vibe with people right away or even through the conversation. But I think, again, yesterday at the Ascend leadership session, they really talked about identifying various levels of people. And one of the things that is important is first identifying who's your support system immediately. And those folks can really give you some ideas about who to connect with and talk to. So I think the immediate community is just so important, and just being open-minded. Like it's not all about title, right? So a
Yeah,
lot of it is, what can you learn from this individual that's like sitting in front of you? And that's the approach that I take in general with the podcast. It's like, sure, I got a PhD in clinical psychology, but I see that more as like um that creates its own biases, right? Like people think, "Oh, I am psychoanalyzing people all the time." But I have to actually set boundaries, and I'm like, I'm not going to sit down with someone if I'm talking with them at the airport. I may have that in the back of my mind, but that's not the forefront of what I'm talking with this person about. There's like, how do you be human and connect with people and just try to understand them?
yeah, yeah. I think yeah, I just think that is just so important. And there's all these things that we put in place for ourselves throughout our careers. But the one thing that I know that so many people are afraid of facing, which comes from the anxiety, the self doubt, and everything, is failure, the big F word, the fear of
I
failure.
can think of another F word that I love, but yep.
Right. And, just the avoidance of failure and all these things that we do for ourselves to um, try to never reach it. But of course, it's always going to be there. And, we talk about people that don't have the resources for mentorship,
Mhm.
for career coaches, therapy, all these things, and they actually have to face failure head on. Um, is there any advice for people? Like, I know for me, I know I just asked you the question, but I'm gonna just give a personal. Just for me, I am no longer afraid of failure, and I don't know if that's a good thing or a bad thing. I faced this so many times to where I'm just like, well, we'll get them next time, type of attitude. Um, but back to my original question, do you have any, um, suggestions on how people can just, face failure, deal with
Well,
it?
we've created it today as like F failure, right? The
Right.
two F words. But I think one thing that's really important is to define what failure is for
Mm,
you. And, did you learn anything from this supposed failure? What are you going to do moving forward? The other question is, will I care about this tomorrow? Will I care about this in a week, a month? In the larger scheme of things, it could feel very acute when we're perceiving something as a failure. But in the larger scheme of our life, like even if you look back like a year, 2, 3 years, like how much do you remember of that instance? There's some situations where we perceived it as failure, and you can either kind of wallow in it. And I'm not saying don't process your feelings because that's important, or you can move forward and leverage it to something else. Because a lot of times I reframe it as life lessons
mm,
as opposed to failure. And for me, coming from a very high achieving high school and group of friends, my parents didn't get a 4-year degree. I'm the only one in my immediate four that went to graduate school. I was the first. And so with that came that institutional knowledge, that social, you know, um, capital, so to speak, of how do you navigate different environments where you have no idea how to do it. Like going to college, filling out a FAFSA, getting financial aid and things like that. Like people could easily say, well, I don't know how to do this. I'm not going to even try. But
right,
uh, it takes some digging deep within you to say, hey, if I don't get it right the first time, I learn how to do something a little bit better the next time. And things don't always work out the way you want them to. And the beauty of it is that when that has happened to me, like I may feel devastated in the moment, but sometimes things work out even better because that happened.
right, right. Yeah, that's really good. Really good. Now, do you know of any mental health resources that professionals or entrepreneurs can tap into to help them cope with stress, burnout, self doubt?
Absolutely. Well, I partnered with, and this is not like an ad. I literally partner with My Wellbeing on the podcast before, and they offer services like a matching services, so to speak. But I love their blog. They recently talked about revenge bedtime procrastination, and what that means. And I'm like guilty of that. Is that
Right.
when you don't feel you have control over your daily schedule, like during the day, you then stay up really late at night watching TV, scrolling through social
Mhm.
media, doing whatever you feel like you wanted to do during the day. And that really impacts sleep. So
Mm,
that's one thing. And then I would really try to join various listservs out there that even though some of them are referral sources, they also sometimes host like networking events or consultation groups. The cool thing about it is there's so many free resources out there now. It is really hard to sift through because there's so many resources. But I think just talking with one or two trusted people of like where they seek support would be really, really helpful to start to get into these smaller groups that may feel less overwhelming. And then of course, I'm always an advocate for individual therapy. If you can afford it or find, some your insurance can cover it, or there's a even like the Asian American Mental Health Collective, they offer sometimes a fund to help people have a few sessions of therapy, or they sometimes host like free group sessions. And so there are a lot of free resources out there for sure.
Yeah, that's good. I was just thinking about a board that I sit on for an organization, and I know that their HR department is real intentional about providing um, benefits, a benefit package that addresses like mental health issues, burnout, and things like that. And one of the things that they provide is like the telehealth to
Hmm.
where like their staff can access services on their phone whenever they need it, and like mental health day off, like a mental health. I think the staff get like 1 day off a month for mental health, and I think like a support, like a staff support group or something like that. And just hearing the things that the things that you were saying, um, the different levels of impact of how staff can or individuals can be helped in situations like this. Like if they can't do it for themselves, thinking about the company or the organization that they work for and how they can help or implement policies to help support the well-being of their staff as well.
Absolutely. As a program manager, I encourage my staff to use their sick leave for both any physical or mental health related things like taking mental health leave. I think it's so important, as if you're in leadership role, to demonstrate and, not just talk the talk, but like encourage staff. Hey, this is just as important as physical health. We're talking about holistic health here. Now, I happen to be, in a mental health environment to say and show how important it is. But I think people, especially during the pandemic, have started to recognize how important it is and have more employee assistant programs and ERG groups for belonging, DEIB, etc. Like while I have conflicted feelings because it's become a buzzword, and people become the coordinator of DEIB. What does that really mean? I think that's the other part, is really contributing to these resources so that they're useful and people can access them very easily and don't feel ashamed. And I think maintaining confidentiality, and understanding that and communicating that, no, your supervisor's not going to know what you talked about in a session, or that you even sought the help.
Yeah, yeah, it's really important. Very important. So before we close out, I wanted to talk a little bit more about your podcast and the projects that you're working on right now. So your podcast, The Color of Success, how has it contributed to changing the narrative around mental health in the Asian communities and other communities of color?
Well, the nice part is that I get feedback from the community that these stories really resonate with folks.
Mhm.
And because it has been so diverse in terms of industries, and people's experiences, I've been really fortunate that people have been vulnerable. They've
Mhm.
shared their stories. They've shared about their, many have parents or grandparents that were immigrants, and how that really contributed to their work ethic or their resilience, or ways that they've dealt with ongoing like self doubt. Like I said, there's a difference in generation sometimes of it was survival versus now. It's like, because our ancestors have fought so hard to give us opportunities, it's a different issue that people are coping with. And so I think and I hope that people utilize these stories to not feel as alone in these struggles. We recently shifted because I needed a break, but we recently shifted to having folks on in the entertainment industry. And so we've recently released an episode on Henyos, which are the divers in on Jeju Island that range from their 50s, 60s, 70s, and even 80s.
Wow.
And there's a documentary on Apple TV about it. And the great thing about that is it really talks about stories of resilience.
Mm,
A lot of women went into this profession and at the time were really looked down upon because their skin was darker. They were diving for like 8 hours a day. They still don't use like any extensive technology like tanks. Um, Oxygen tanks to go down there and there's environmental factors that contribute to the profession kind of dwindling. And
mhm,
so these stories really inspire me as well. It's not all altruistic, right? When I hear that, I'm like, this woman is dedicated to this profession until her 80s. She's still diving, like I think it really changes the perception of how long we can work, how we
mm,
can contribute to health. And the newer generation of Henyos, two of them, they've really started to utilize and leverage social media to their benefit. And one of them went because she didn't want to be in a cubicle anymore. She was like, am I really going to be in this life where I have to be here 8 to 10 to 12 hours a day versus being in the ocean and, having that sense of freedom?
and anxiety again.
Yes, exactly. And
Right.
it's not being in a cubicle is not for everyone,
Right.
right?
It's really not. I think I need to be out in the ocean too, so.
Yeah, exactly.
Recently you, published a book. Can you talk a little bit about the book?
Yeah, Cancel the Filter was a project of love because I had it on my desk for many years and the self-doubt started creeping in for me of like, well, what do I really have to offer? Everyone's putting out these books and you can really get in your head. But what my story is really about is it's personal. And I think some therapists are a little worried about putting so much out there. Of course, there were boundaries around the extent to which I shared. But the whole idea is that on social media, we have filters on, and you only see a snapshot in time. And the thing is that as a mother and a working mother, there's all sorts of societal expectations about that. And I actually went through a pretty difficult time with my first child where I was in a pre-doc internship and I thought, okay, I'm going to take my licensure test before I give birth. And well, she wanted to join the party early. And so I had to study on my hospital bed while I tried to keep her in for a week while I got the steroid shots for her lungs and things like that, and dealing with the NICU and stuff. And I think there's this expectation that when you're pregnant, everything should be happy and all good. And I said, you know what? Even now, I'm 10 seconds from losing my shit all the time. You can bleep this out. But it's half joke, half real in that like there's some times where you want to go in fetal position because there's so much stress. And it's also a beautiful thing, but recognizing my limits and telling others like the headline for that, the subtitle was pregnancy was not a party, at least for me. And I spoke with a mom at the airport recently who has 6 children,
Mm,
and she's like, thank you for saying that because a lot of my friends are saying, yeah, it was so great. And there's actually difficulty when women have C-sections or they're in labor for 20 hours. And then they're apparently have to like be the primary caregivers. And my husband is a feminist. He'll never call himself that, but we have girls and he does all the cooking. And we get judgments all the time like, "Well, you don't cook?" And so my smart response is, no, I make money." And so he
period.
makes money too. He works and stuff. But I think like I tell my clients to come up with like maybe a line or two to kind of address it and shut it down when you don't want to have conversations. There's so many women struggling with fertility, with IVF and everything. And so, another one that people say, are you going to try for a boy? And I'm like, no, I'm a feminist. It would be nice, but I think
Feel
that
like it.
Yeah, exactly. I'm just like, I'm good. Like, if you want to carry the baby, if my husband could carry a child physically, sure, I would do it. But my body's been through enough. So
Right. Exactly. And that's true. Just postpartum and mental health is a whole nother conversation.
yes.
That's a whole nother episode in itself.
Yeah. But I'm
'Cause
hoping people feel less alone when they read my story and recognize that like we are expected to be super women. And people have said that, like, how do you manage everything? And I'm like, there are many times where I don't, and let's be honest about that, I will volunteer and, donate to the school and things like that, but I don't have the bandwidth to be on the PTA. Like I can't,
yeah,
it's not logistical for me.
yeah, I think that's my weak spot right there is the bandwidth. I'm definitely still learning my boundaries when it comes to
For sure.
my bandwidth because I'm such a like a community giver. You ask me, I'm there, whatever, scooping, helping, whatever. But at the same time, I got a whole business and everything. And I just don't, yeah, I run myself very thin. So,
Mhm. And I still do. So I'll validate you, like it's an ongoing struggle, especially for women of color who we face some societal obstacles for sure. And I think sometimes we can start to believe that narrative about ourselves.
yeah, it's very true. Very true. So, as we close out, even though I've thoroughly enjoyed this conversation, I feel like I could go on and on just talking about just the professional life and just managing it, managing your mental health and your position in society is such a deep conversation. But what would you say are the top mental health strategies for professionals and entrepreneurs to adopt in order to thrive, just personally or professionally? Like, what would be that? Like the top few things that you think people should integrate into their life.
Well, I would say my value is to strive for inner peace. It's an
Mhm,
ongoing thing. And I recently went to the Teddy Swims concert. So I will say that he says, in the end, what is important is love and
mhm,
connection. And if we focus on working all the time, I think about that. Like obviously turning 40, I had that acute awareness of mortality is like, well, at the end of the day, if someone asked me what was important, it it was like connecting with my family and my friends. And what are we really compromising and is it worth it to us
mhm.
to do this activity versus, like I said, go to a music performance for our kids or something like that. So I try to like make my decisions based on like what's going to be more meaningful, what's going to be the memory that sticks with me at the end. And that can look very different for people. But learning distress tolerance skills, I just started the day with a daily meditation, which I'm starting to integrate a lot more in my life and journal and really focus on self care and coping with rejection. That's like we talked about, that's huge.
Yeah. All of that really does make a great balance. It really does. The formula for a great balance. So thank you so much, Dr. Wong. I really, really enjoyed this conversation. You gave us a lot of great nuggets, and there were a lot of resources that I'm going to post attached to the episode. Of course, your book, which I believe is on Amazon.
It
So
is, yeah.
people
It's and
there.
I tell people it's not for everyone. I'm very direct, straight talker. I learned from the best as I worked through the years, right? And like I think a lot of people could get very theoretical on things as mental health professionals, but at the end of the day, what's going to resonate with people um at a human level. So, if anyone reads it, I would be happy to connect and just like get your thoughts on like what your stories are and, if it was helpful or not, and what we can do to help people feel less alone.
Yeah. Thank you. Thank you so much. You are definitely a true light. And we thank you for your gift because it's
You
definitely,
too. You
yeah,
just remember that you are a gift to the community, and especially with the challenges that and the changes San Francisco has faced. We really need people like you in the community, and really inspire you're inspiring so many people to work on their mental health, and really come together, because at the end of the day, it is about community and working together despite, you know, the divisiveness sometimes that happens.
yeah, very true. Thank you. I received that.
I'm glad.
All right. Thanks again.
Thank you.
All right, let me figure out how to shut this off. Perfect.